Welcome back, everyone. It is a lovely Saturday, at least in Los Angeles, where I am. I'm your host today, Dr. Carpenter, Co-Chief Executive Officer, Chief Strategy Officer for the Boston Congress of Public Health. We're here with our new interviewee, Sonny Patel, one of the 40 under 40 Boston Congress of Public Health Catalyst Award winners. Welcome to the show, Sonny.
Thank you. Thank you for having me. This is wonderful to be able to spend a great Saturday evening with you. This is great.
Awesome. Perfect. We're very excited to have you on and discuss lots of different things that you're doing within the field of public health and beyond. So, Sonny, tell us, where are you calling in from?
I'm calling in from Atlanta, Georgia. Just made the move from Los Angeles to Atlanta. So I was just in your neck of the woods, and I end up checking out this hot summer thunderstorms that we're having here in Atlanta.
Oh, that's lovely. Yes, that is definitely, more of a southern thing. Here in LA, it's just, as you know, baking. So no rain for us. But Sonny, tell us, are you originally from Los Angeles or Atlanta, or where do you where do you come from?
Yeah, no, I'm born and raised in Los Angeles, but I've traveled through my work and through my education and experiences, be able to travel many places around the world, from Japan with working in Fukushima to Chernobyl in Ukraine and East Ukraine to the UK and London with flooding to India to South Africa. And it was just, so far, the journey's been, as we'll probably get into it, has been a lot of challenges, but a lot of growth and, a lot of great people and communities that, I've been very fortunate to not only hold their trust, but also be able to work with them to, improve health outcomes, not only in their communities, but at businesses, at healthcare, but at individual level as well.
Ooh, this is going to be good. We'll get into that. So as far as I know, you have been a fellow with the Transcultural Conflict Violence Initiative, as well as a visiting scientist for the Harvard Humanitarian Initiative. Can you tell us about both of those initiatives and your work with them?
Yeah, no, it's been great. As you know, and probably many of you know, like public health is a vast field, and when you get into helping, especially in the work that I do with emergency management and disasters and conflict, and dealing with uncertainty that exists in the world, and kind of helping communities to prepare, to respond, and recover from such events. It takes a very multidisciplinary, interdisciplinary teams with a lot of support, not only on the ground with local communities and leadership, but also all the way up to large organizations like United Nations, like NATO, WHO, governments, and and institutions such as Georgia State and Harvard T.S. Chan School of Public Health, of supporting such initiatives that really focus on bridging the gap between research, practice, and policy, and bringing it together to really help communities meet them where they are and help them and help themselves, but also build resilience in the process and partnerships for long-term sustainable development.
Absolutely. And specifically, so the Transcultural Conflict Violence Initiative, what are some of the projects, or at least one project that you feel particularly proud of or inspired by, or I guess felt transformed by?
Yeah, no, I mean, I can talk a long time on both the institutions, and there's probably a lot better people that's been there longer than me that deserve that to talk about it. But I think what makes you, well, we'll start with Georgia State first. What makes it very unique is not only is it full of faculty and doctoral students, postdocs, researchers, and practitioners that come in together, but really it's kind of understanding the root causes and creating solutions and the impacts of these issues, not just domestically here in the US, but internationally. And now with, not now with, it's always been around, but using the impacts that we see in social media with disinformation and, misinformation, and then the way that it builds around there, it just, with with Transcultural Conflict and Violence Initiative (TCV), it's just very impressive of all the things that not only my colleagues are doing, but also what I'm, part of the team to build is to understand these growing threats around the world and address them before it becomes a global bigger issue than it is right now. And not just that, using innovation and technology to cut through and create new solutions, and maybe even recycle old solutions that can solve not only the healthcare issues that exist from these communications and through these kind of threats through hybrid warfare and other techniques that many bad actors in the world that are currently doing, but also meet different other aspects and creating a common good for all.
Absolutely. And so, given obviously all of the conflict that exists in the world, interpersonally, geopolitically, et cetera, and can you, you talked about having traveled around the world. Are you comfortable telling us about a scenario where you felt you made a particularly large impact?
Yeah, I mean, uh, I think we wouldn't be this far into our career without having hopefully some of those stories, because I mean, those are the stories you hold on to when everything goes wrong and you're trying to continue to persevere and continue to build solutions in kind of hard places where there's a lot of tough choices to be made. I mean, a good example of, like you mentioned, is with the team at the Harvard Humanitarian Initiative. We have several different projects, and Harvard Humanitarian Initiative (HHI) is a university-wide academic and research center that really kind of focused on collaborating across the aisle with different groups, but also improving the effectiveness of humanitarian strategies for relief and protection and prevention. But also, what we have done on one example to what we're really proud of is, our partnership with NATO. And before, the Russian invasion in Ukraine, we developed a few projects to increase training capacity in the front lines in the healthcare in East Ukraine. Bringing a week long, bringing experts and professionals from all around the world, bringing in private groups that are trainers, but also have equipments from ultrasound to medical innovations to startups from Silicon Valley, Silicon Beach in California, but also from the Boston startups as well, bringing in kind of health innovations that can be done in mobile and in front lines in crisis scenarios where it doesn't need much, it doesn't have much resources or even Wi-Fi in some places. And what we were able to, we trained over 1,000 individuals, and these are individuals who are currently serving the Ukraine and helping the country kind of battle the invasion currently in Russia, and building and saving lives through and through, from injuries from the war, but also from the large displacement that's happening and the mental health the mental health impact that has continued to be seen in Ukraine due to the invasion.
Absolutely. And so, Sonny, can you tell us how did you get into, these particular field aspects of public health? Emergency management, community resilience, disaster work, of all the different areas of public health. What prompted you? What provoked you? Did you pivot from one place? Did you always know that these
Yeah.
areas were something you wanted to be involved in?
Yeah, I mean, I think early in the thought process education, I think it probably goes even before my time at University of California at Berkeley. But really, kind of understanding, the question that I ask a lot of my mentees and classes that I teach around this is, like, really developing your passion, understanding what the passion is, and knowing that passion can change as you grow, and, like you said, pivot as things kind of opportunities arise. But I mean, I think for me, the journey started of the old quote of see injustice, make a change. And so it's a little bit of trial error early in my career of working in India and working um, in rural parts of India and rural parts here in America, to really kind of understand a little bit of how we can promote health promotion and better communication to lead better health outcomes. And things kind of really clicked when I was at USC with lovely colleagues and mentors, Dr. Jonathan Samet and Dr. Heather Withley, on really building their Institute for Global Health that emerged there. And what really we were talking about is, there's a lot of injustice that we see in the world, and especially in public health, we kind of explore that and try to help kind of correct that in a way to build and empower and establish, communities to help themselves, but also help teach us of how we can do better and how we can support and how we can create better community outcomes. And one thing that kind of led is the looking at the Chernobyl disaster and the long-term consequences of that, specifically the psychosocial consequences and the legacy with mental health and the stigma that comes from it. And during that experience with our international partner, Green Cross International, and lovely colleagues both in Ukraine and in the surrounding countries and areas, really kind of allowed this wealth of not just support and knowledge and trust to really kind of found my I guess the calling, you would say, of understanding that, you when the disaster happens, when we're sitting at home and we're donating our hard work money to help others, and we're giving and sacrificing, our clothes, and donating food and supply to help, and you're hoping that it goes to the places that needs it the most, that can help. And in many cases it does happen, but in a lot of other cases, once that dries up, what happens next? It doesn't, it's not like there's a time point like, hey, 3 years after a certain disaster that, these communities are supposed to be normal again, that you're back to normal, but that's not the reality. And so, especially if there's already, before disaster hits, there's already injustices such as corruption and inequities that exist already. A lot of times disasters amplifies that and or expose that even further. And so many communities and populations are even more vulnerable after a disaster, where they're kind of even further away from what a good normal would be. And so all those were um, interests of mine to explore and see how I can leave the world a better place by interacting and learning and being able to impact that and help as much as I can.
And tell us a little bit more about, you talked about, because in some of my studies, definitely nowhere near your level, but there's like the in terms of a disaster, there's all the things that can happen before the disaster, right? Like the preparation work, emergency management crew might do, to prepare. There's what you do actually as disaster unfolds, and then there's all of that stuff at the end. Can you go a little bit more into depth about things that happen post disaster? Some of the things that are important in helping a community to be resilient and build itself.
Yeah, I mean, happy to kind of go over it. I'll give it as much broad as I can, and I think my publisher will be mad if I don't put a plug in for the book that's coming out in a few weeks that actually explores this in a very small case study in the UK with flooding. Well, the book, When Disaster Strikes. Community resilience when disaster strikes. But quickly about it, we have the direct and indirect, right? So we mostly kind of, we meaning us public, and understand from the media, is the direct, the property damage, the destruction of cultural kind of significant areas, the community centers, and then the indirect, right, the loss of education, the interruption to businesses, to kind of daily life, the the in many cases the internal displacement that may occur, that do occur quite often, due to large scale disasters. And so in knowing those kind of outputs that we have, and we have years of data on this, right? Because disasters isn't just happens once a year; it happens a lot. Actually, in 2020, the recorded amount of disaster was over 400. And so I ask you, like, how many disasters can you recall in the last 2020? I mean, obviously we had a pandemic, so that was a lot on everyone's mind. But think about it, over 400 disasters occurred worldwide. And of those, you're right. You're thinking of millions and millions of not only dollars lost, but also you're thinking of millions of people affected. And I think it's over 100 million people that were affected in 2021. The death count was, I think, close to over 18,000. But the number that I think, to kind of hone this in and to answer the question, is, you know, um, we have the internal displacement that's actually seen even a lot more than we ever seen with disasters. I mean, I think of all the internal displacements recorded worldwide last year, 38 million was the total, and over 60% of that was caused by a disaster. And so that's close to what, 23 million, 24 million people. And so when you're looking at these, big statistics and you have big data, now you're asked the question of, well, what can we do? So, the traditional emergency management and disaster preparedness kind of ideas of, well, we got the prepare, you got the respond, you got the mitigation after the recovery, and you're trying to do the cycle loop. But in this process, not all communities can have the same model, because not every community, as you know from your work and your wonderful studies and work, is that the they're all not homogeneous to a certain demographic, certain equity to resources, to certain kind of even knowledge transfer from past disasters. You would think that some communities who've been dealing, for example, like flooding in the UK, you were thinking that some of these places that have been dealing with flood for centuries and documented it for centuries will have this knowledge transfer of knowing, even informing new residents or new community members to understand, hey, when a flood happens, these are kind of the things that we do to when we respond, but also these are the things you do to, protect the community, to protect your neighbors, to protect your own home, to mitigate such, hazards that occur. But that's not seen. And a lot of times the lessons learned don't transfer over from disaster to disaster, even in the same city, more or less than even the, different countries. The sharing of those lessons and implementing it seems to be a big gap there.
Yeah, I appreciate you putting in the plug for your book. I was going to alley oop that for you, regardless of community resilience disaster strikes. So for the audience, definitely check that out if you're interested in.
Yeah, I mean, we're hoping to get it at. I mean, I think it's at Barnes and Noble. I'm sorry to plug the only brick and mortar store that probably exists still, but I appreciate all those things that are happening. I mean, I think it's pretty neat. I mean, as you mentioned, I mean, I've traveled quite a lot, and you're at bookstores, you're at different places, and it's. I mean, the book obviously is very kind of research and practice for focused, but I think there's a little bit for people to learn from that, and I definitely know that there'll be some classes hopefully that'll be incorporated, in different universities around the world that will pull from some of the information shared there to really challenge and develop a critical thinking around this space, because we don't know all the answers, and we continue to learn and continue to learn from people who experience this and being able to help them. I mean, they're the experts here, and we're just listening and building and learning and helping to kind of connect all these different pieces that happens from the past to the current, and really kind of project of what type of things we can protect against the future.
And one thing I was curious about, and what you were saying, Sonny, is even though many of us at the forefront of our minds has been the COVID-19 pandemic, is that there were 400 disasters that happened. And so for the audience, let's go into that, because when people think disasters, I think some people have preconceived notions of what that might be. They might think immediately fires, floods, but can you delineate some of the different types of disasters, and some that might be that people may not have as top of mind?
Yeah, and this goes like when you talk about the political stuff, some of this is even political, because what some is called as disasters, let's say, for example, United States, is firmly defined by when the office of the U.S. president, you know, allocates disaster funding, or allocate that it's a disaster by request through the process here in the U.S. is the governor requests to the president to call this a disaster, and that's when FEMA can really come in and do response and crisis and recovery stuff with it. But until that moment, it's a local hazard that's meant for local communities and state to kind of cope with. And internationally wise, that's disasters is kind of looked a little bit of different. It really deals with anything that kind of leads to mass casualty. Even though you're doing prevention, mitigation, preparedness, and recovery at a lot of things, it's dealing with mass casualty events through you mentioned fire, through other hazards that exist, but also floods, heat waves, cyclones, landslides. earthquakes, and I think what's merging now, especially after the pandemic, or as we're still in the pandemic. Sorry, please let me correct myself. I think think I think we're still seeing a lot of people looping in disasters, things that could have been preventable. Like for example, when we think about building constructions, it becomes a man-made disaster. There's no such thing as natural disasters anymore because a lot of these are preventable, and we have enough information and resources that could have saved a lot of lives. For example, again, using the example of building constructions, to be, resilient against certain levels of earthquakes and whatnot. But not every places around the world have, the financial capacity to be able to invest in this, but also the willingness and the resources that needed to secure that. And that even goes to flooding. I think those two are good examples of that. There are enough resilient infrastructure that could be not used if, but the finances around it and the commitment by various different stakeholders tend to come up short because it's not required of them.
Yes, absolutely. So thank you for delineating all those different types of disasters. And obviously, I mean, just thinking about it, like how you said, the learnings we can take, from the past to the present, case study by case study. But I imagine you would probably say no two disasters are exactly the same.
Yeah, I think that is true. I mean, I think that's I, one of the challenging part of working in emergency management and disaster. I mean, you have experience through different situations that allowed, you know, a good emergency management professional to really help. And like I mentioned earlier, the teams that work in this space are incredible, being very from various different backgrounds and disciplines that really come together to bring in different thinking, but also cooperation, collaboration to all have a common goal, which is to help the communities that are the most impacted and infected by these disasters, and kind of help the recovery process. And again, all of our goal is to, lead that positive trajectory to better functioning than it was before the disaster hits, ideally. But that's not always the case, and politics plays largely into it. Obviously, funding shapes and funding priorities shaped some of this work, and a lot of this work, I think, as you know, in public health, is shaped by funding and the priorities and the amount of commitment, not only stakeholders locally, but also in the governance sector. I mean, I think there's a lot of progress been made over the years in this space, especially with the Sendai framework for disaster risk reduction being like the next kind of step forward from the previous United Nations, WHO, World Health Organization's cooperation treaty and document that really shapes some of the governments of holding states at least responsible, or acknowledging the responsibility that states have in terms of the process of helping communities of their communities that's been affected by disasters, along with partnering with non-governmental organizations and international non-government organizations to cooperate and help them with the humanitarian assistance, but also with the recovery and future process of mitigation of future disasters. But it's still a long way to go because, as the mantra, as people that were trying that being built, right? Not only is there's no such thing as a natural disaster, even that term still exists, and still people use it as practice, but also that the goal is to leave no one behind. And if we're truly looking at leaving no one behind from a disaster occurs, whether that's at the emergency management level, or if you're going up to the policy, to even the practitioner intervention level of building the capacity at community level to build community resilience, you're really thinking of you're really trying to fill in this big gap that exists over the years, because there's a lot of challenges that are not unique. Like the challenge, for example, if you go individual level and you think about individual resilience, a challenge with a person with a disability versus a person who is able, the response team, the emergency response team, may have different protocols for such, and some may not be done in a way that dignifies the person, and understanding that even some people may be ill prepared, and even not want to leave and evacuate. And so if you're really thinking about, again, leaving no one behind, then what are we always doing in conflict areas, in areas where there's fragility in the governance in the state level? So there's a lot of these questions there, and a lot of non-solutions, just kind of band-aids of good people coming together to solve solutions that, I mean, to create solutions, that affects us now, but not really a sustainable, development, or an option for the future.
I think that's so important, just discussing the challenges, right, that exist around being able to have that disaster, management, mitigation. As you said, like the political infrastructure, the mindset of the community, and some of these other external factors. I wanted to actually get to, you mentioned this briefly, equity. And how does equity figure into emergency management and disaster preparedness? And if you want to give a specific example, that would be great too.
Yeah, no problem. I mean, you can try to find all the highlights from all of my past public publications. I think a recent one that talks around equity in here in the U.S. Looking at FEMA, at the U.S. Federal Emergency Management Agency, and the case study around programs that they invest and that they work into, and it's challenging. I mean, as much as, like, let's say there's a lot of millions of dollars that's given out yearly by the U.S. government to help different states, different communities, to not only respond to disasters, but also preventively, to mitigate disasters, from new equipment to places. And a lot of times when we see it, like in the us in the public, we see it through the media, through, oh, this county just got new boats, new tanks, new whatever it may be, new type of resources, and you kind of puzzle sometimes. But it's through these type of agencies that they put in, that maybe we can kind of create to it. But then when you follow the dollars, a lot of times there are things that are not equal. Places that that actually need the funds to support some of this are left by themselves, or left with the bill with their insurance, and then a lot of times insurance don't pay out. um, and that becomes a greater challenge, where people just live in that area. I mean, I'm sure we can talk about Hurricane Katrina for a lot, but I'm not going to kind of dive in. There's a lot of my colleagues talked about that, but I will talk about a little bit more about FEMA's examining their programs, looking at the lens of equity, and myself and colleagues at the Rand Corporation, and what we really looked at when we kind of looked at this review is, we understood that there's different equities that you could shape, and equities that exist in the US. And we focused on three. We looked at the procedural, the distributive, and contextual, especially when you think about in a disaster. I mean, those tend to be very clear examples that I think a lot of us wouldn't argue around, right? In terms of, when you think about distributive equity, did the resources go where it needed to go, right? Whether or not, people who've been marginalized in the communities, but they still have, you know, impacted, and a lot of times have the most disaster risk in the community. Did they get the help and the support that they need to make sure that they, remify the solution, and kind of get back to that trajectory of positive functioning, after disaster happened. And in our study, in our review, in our case study, to really understand, whether or not this exists, it really kind of comes down to how, believe it or not, that we don't really incorporate the equity lens into practice well enough, or even into the decision making skills, decision kind of process in programs, into funding. And that's what we need to do more, especially with using community-based approaches, especially here in the U.S. Community-based approaches tend to use a lot in the European and in the UK communities and governance, but in the U.S. it tends to be limited. Of, well, we put out a grant call and communities are encouraged to apply, but as you know, not all communities are equally gifted to write a grant. I know before I started my career, like, grant writing was a whole nother art that you have to learn. And we tend to fund those well-written ones, and sometimes creating different opportunities that create more diversity in applicants, but also diversity in approaches, gets to have a better safety net for everybody.
Absolutely, and the values of the Boston Congress of Public Health are absolutely health equity and social justice. So I'm very fascinated with the three forms of equity that you talked about: procedural, distributive, and then contextual. And I feel like I've got a good grasp of the definitions for procedural and distributive, but contextual. Could you define that a little bit better for us?
Yeah, yeah, and of course, and this is actually based on a theoretical lens and actually a practical lens from another scholar, who put in more time and shape, and we're adapting it for the lens here in disaster research and disaster and emergency management and disaster prevention. And so the way we think about, let me see, the best way to explain this, the way that we think about kind of contextual is the enabling conditions that determine people's abilities to both participate in the decision making, the brainstorming and everything, but also gain the benefits. And this is based on McDermott and colleagues from their 2013 work, where they talk about this three dimensions of equities, and we talk about distribution, which is the equity in outcomes and how it benefits and costs distributed across different groups. And then you already know procedural, but the representation, right, in the decision making process. And but the contextual, sometimes we forget that you have to enable the conditions, because currently there isn't much equity in many of these spaces. So we don't know what we don't know. So if we know that currently the societal norm is to allow our local elected leader to make the decision best for us, we don't know that we can call their office, we could write to them, we can send notices, to send note, phone call, to do all these things to empower a local leader to know, like, hey, we're hurting here, we need this, we need that, and know that their elected officials here to represent everybody in the community, not just those that may have elected him or her, or they, into power, or into power, sorry, into elected role.
Mm. And as you're talking about this, I feel like we've talked about some potential barriers to equity, in terms of political infrastructure, funding. But what about facilitators? Let's take a positive perspective. How can we augment and amplify conversations about equity into emergency management and disaster work?
Yeah, that's a great question. I mean, I think with any good equity approach, it's multi-pronged, multifaceted, right? You could, I think, empower it from the bottom up, but also, empower from the top down. I mean, I think first, and FEMA, the U.S. federal, the U.S. kind of side of things of the government, that have been making steps towards embedding more equitable solutions and processes into their programs, and into the funding and into their work, and is just continuing to do that and making sure that the politicians and the elected officials are continuing to understand the need for intentional equitable kind of resilience to occur here, but especially in the disaster and emergency management space, here in the U.S. A lot of it is still, for many times, is a buzzword for election year, but it is, an actual and operational thing that can occur and should occur, that would help communities not only feel that they're left behind, but they're not feeling like that if there's equitable solutions that can help everybody kind of create that positive functioning, not just those who are in the know, or those who happen to be in a good place, or those that just well connected to be able to put in things for the funds, or have enough financial resources to sustain such damages and impacts from a natural hazard. Um, Now, in terms of the local thing, I mean, there's several grassroots and nonprofits that exist in different parts of the U.S. and even globally, that works on this to really empower and help and advocate. I mean, in the UK, there's some large flooding associations and nonprofits, and a lot of my colleagues in the UK who are just advocating and championing and talking to the mass media, to everywhere, to talk about this. Because if we don't talk about this, it goes away, just as you know, in many public health issues. But with disasters, is more particular when there's anniversaries, and you'll notice this in the media when there's anniversaries for a disaster that occurred. We tend to kind of remember it, and tend to kind of cover it. And these are a lot of times where we have to create that advocacy, and also be able to speak up for to help us against future disasters, and allow us to understand that you know just because the disaster is over doesn't mean that we're all good. There's more work to be done. There's things that unfortunately, going to be living with, that we need to continue to help and support. And one of the example is the mental health impact that occurs.
I think that's significant to say. And I'm just sitting here thinking about, the reasons why, the general public may want to forget about a disaster. Say, I mean, just the extended time that the pandemic has had, just a sense of fatigue, or
Mhm.
maybe just naivete that we continue to think that, oh, okay, it's done, and then the next one hits, and then we go into the same cycle of rushing around, and then oh, it's done and moving on. Okay, and so it's like this amnesia,
Mhm.
that people have, and so this might bounce into my next question. Emergency management, disaster reduction seems kind of niche. What are your thoughts about that?
Yeah, yeah. I mean, I think it is niche when in the grand scale of public health, and especially when you think about the funding and not only research dollars but practice dollars that kind of flow into this space, and even with a lot of it, especially in the U.S. and in Europe, is a public-private partnerships in many ways, because a lot of private companies are heavily invested in this space as well to help. Because of their employees and different places that their consumers are experiencing their products, and but I think with the niche question, I think it, it's the understanding that it's not less relevant. It's something that we all find relevant when it happens to our own backyard, when it happens to us, and we're like, oh wow, how come there weren't water supplies? The fire was here. Why weren't they ready? Why were this and that? And you talk about the pandemic. Not only the public being kind of fatigued, but there's also fatigue, on the practitioner side and even research side, and everyone kind of contributes to it. And I think when you deal with something, that a field that as niche and specialized as emergency management and disaster risk reduction is, like you're dealing with people who have a lot of traumatic experiences, whether it's primary that they went there on the ground and suffer and kind of been part of that, but also maybe even secondary. And so we have these traumatic experience that we also are coping with, and learning and growing with, and being able to process that in a positive way to provide good support and help to others, but also the burnout from that, and understanding that not enough is being done towards that to help managers and help disaster risk reduction practitioners and researchers um, to say, hey, it's okay to not be okay. Let's get help, and be able to help you work through, with professional help, to deal with the stigma and the mental health issues that's being seen because of it, and also the infliction that occurs both ways, both of overworking and working long hours, like in most jobs. Like it's the same thing here, working long hours and intense hours, to knowing that, like, if you don't come to work, you may be letting communities down. You may be, letting your colleagues down who rely on you and support you, that you support to help with communities that are dealing with most likely their worst day ever. Many losing their homes and what they know is their normal. That's we talk about it, but feeling that from an uncertainty, from a natural hazard, from such a disaster, it's even the smartest people kind of just go frozen of like, whoa, I did not expect that. What am I supposed to do? And that's the shock. And so, and for some people, the shock goes for a long time and even stays in denial for months to years afterwards. But also, and then the work begins of them kind of processing it. But some of them happens in the moment, and sometimes in a very emerging situation, you need to kind of react and be able to help process that quickly.
Yeah, I think it can't be overstated. Everything you just mentioned and delineated, just the huge impact of dealing with a disaster like that, and then the fallout, as you said, for weeks, months, years afterwards, that I think so many can take for granted.
Yeah, and I think the other bit is also knowing that when a disaster occurs and you're identified as someone who had a disaster, right? There's this level of, you feel like you're, the identity, right? As we see in other public health research and issues, right? When something happens that is a negative consequence, right? The victim and the different identity that we go through, especially if our identity was our home and now our home, is gone, and that might be generational home, that might be, the livelihood that you have, your livelihood has shifted. And so understanding that, and then you you put on that on top, right? You get people who are researching and trying to learn more from it. And if there's lack of coordination among that, especially in a niche area, if you're lack of coordination, you keep calling the same house to be like, hey, we had the study to understand what went wrong so we can, advocate for better policies, more funding, and all these things that, we do in public health to help everybody as best as we can. That can create, this research fatigue that colleagues and I from King's College London have, you know, um, talked about in a past research publication, and really shared different kind of anecdotal stories and case studies, especially from that I've done in the UK, and some of it in the book as well, talking about how, we all need to do better. As much as we're reacting to, you know uh, disaster, and we're all trying to help the best way we can, offering our skills and abilities, that there needs to be not only coordination but communication amongst everyone to understand that, one, we're all human and the people affected are human, and to be able to understand that that humanity needs to come first. And two is, first listening to what they need, and how that, instead of what other agendas and other things, as with academic and some of the research, it might be all about publications, but in reality it should be about the outcomes in the communities and the people we're serving.
Yeah, I couldn't agree more. And I like the term, research fatigue. It's the first time I've actually heard it. The one I've heard the most bandied about is compassion fatigue. So that's just another one. I think, myself and then maybe the audience can add to their arsenal of things to think about, the different types of fatigue that can exist. Not just within the people who are afflicted by the disaster, but those who are studying it and trying to help mitigate and or reverse it to whatever extent. Sonny, to segue into the last part of the interview, you are a 40 under 40 BCPH Public Health Catalyst winner. Has your life changed since the award?
Well, I think it's still early. I mean, I changed coasts, so I mean, I think that's a start. Maybe I'm coming to the center of what people would say public health is in the U.S. here in Atlanta, near close to the CDC. So it's going to be interesting how it goes. I think time will tell as we move forward, and gets the opportunity to chat with you, Candace, Dr. Carpenter. It's been just you know brilliant on my end. I mean, again, to for you and your colleagues setting up such a not only a great organization, but the whole cohort is just very impressive, individuals, and it's very exciting to be part of this inaugural cohort, and to be able to not only be peers among them, but also know that we are or hopefully will be alumni of this cohort, to be able to share and help future generation. I think that's what we're all trying to do, right? We're all wanting to leave the world a better place and work together in the process, so we all can have positive outcomes and health outcomes for everybody, and not just those that might be convenient or easy to reach, but to everybody. And that's I think challenges, we talk about equity, and that's the challenge, some of the challenges with that, but that's the ongoing thing that we do with human rights.
Absolutely. And So, Sunny, in the future for other cohorts, what do you envision? Are there any ideas that you have for future cohorts, and as well as yours, because you all will definitely be alumni? What do you see going forward?
Well, I mean, personally, I've been, really f- feeling that innovation and technology is a place that continue to can help public health in ways that we still haven't really tapped on. I mean, some of the things they can do, as we talked about with social media and some of the big data mining that's been done, just very impressive. I mean, I would love to learn more about how we all do that. I mean, I know enough to know that I wish I was back in undergrad to learn all this stuff in computer science and to learn this from coding and grow and develop on this. But I think the future of not just 40 under funding of 40 under 40 public health catalyst, but I think that's the word, that last bit, the catalyst, that we continue to catalyst, not just what we're passionate about and what we do, but also to each other to support and cheer. I think that's something that I hope that I know I'm going to continue to build, and build upon among the awardees here with me, but also and others that the cheering on, it tends to be, as you probably know it, sometimes doing the work in public health tends to be the most isolated thing in many ways, because sometimes there's security issues, so you can't talk about certain work, and maybe even location, you may have to be somewhere else where to be safe in some of these things, especially humanitarian work. And so to be able to continue to cheer on, inspire, and connect to people, and reminding everyone that the humanity is what we're really building here, the understanding, the togetherness, the equity for all, and the understanding that health is a right, is a human necessity, it's a need.
Agreed, 100%. Health is a human right for sure. And you've echoed many things that other 40 under 40 winners have mentioned in terms of working in public health. That is not as glamorous, as many people would think. And as you said, like there can be parts where it can be isolating, it can be humbling, and as you said, it can lead to burnout and all sorts of different types of fatigue for providers and practitioners. So thank you, Sunny, so much for this wonderful interview. Was something else that you wanted to say?
No, I just wanted to say, thank you, and of course that, thanks for the plug for the book, and definitely, we'll do something kind of, hopefully something special for the Boston Congress audience, when the book kind of launches and stuff. We'll think of something kind of creative and something, because again, this is one of those things where, as I talked about, if we're talking about cheering everybody on and uplifting, like, we also have to practice it. So for me, is I'm excited to kind of see these wonderful interviews you've been doing, and also interacting with the wonderful audience that and the community that we're building together, in not only in the public health space here in the U.S. and around the world, but also through the Boston Congress, to be able to build an audience here that really understands that public health is vast, and it could be challenging, but it is also inspiring and innovative, and something that we not only need a lot of great people to continue to work in, but also join us on this challenge to build better equity, and build better human rights for everybody.
Awesome. Thank you so much, Sunny, for this fantastic interview. I learned a lot as always. Enjoyed it very much. So for our audience, if you want to learn more about Sunny, the great work he's doing, go to bcph.org at 40 under 40. And if you want to learn more about social justice topics and public health issues and potentially publish with us, go to our journal, HPHR Journal, formerly known as the Harvard Public Health Review. And we will see you next time. Once again, thank you, Sunny.
Now, thank you so much.